deals with community and public health and racial and ethnic minorities. First of all, as we've been saying all along, the type of community one lives, to a greater extent, will influence the type of health conditions, the health resources, the health opportunities, or those amenities that will enhance his or her health disposition. Those who live in wealthier communities most of the time have wealthier food source, healthier recreational opportunities, access to medical service, and in most cases, they are more educated as a group. So public health for them is not as challenging as those who live in low income communities, wherein they have poor services. Most of the time, some don't even have a grocery store. Some might be dealing with a convenient store, which is loaded with salty food, fatty food, and a lot of sugar. And most of the time, they do not have those opportunities for them to engage in recreational facilities simply because it might not be safe. And most of the time, the housing conditions are also not in good shape. The environment might not be good. Drinking water might not be good. Air pollution might not be good. And most of the time, they live in in crowded homes. Wherein grandma, great grandpa, uncle just live in that crowded. So possibilities for infection is very high. Now, when we talk of communities, most of the time, if you break it down to white communities in general, have most of those amenities that promote health. Those amenities that promote health, they have multiple choices of where to go shop for food, healthy food. Have choices where to go and engage in recreational activities. Choices where to go for health services. Because most of the doctors live in those places. So access to doctor is very easy. But for those other groups, most of the time, access is a challenge. So we can just, as we go along with the chapter, you will see some of the disparities among some of the racial groups or ethnic minorities. How there's a lot of disparity in terms of availability of resources, availability of good housing, availability of safety, because most of the time in some communities, especially minority communities, policing has been a real challenge. Wherein every now and then, instead of dealing with conflict resolution, they use the gun to do conflict resolution. And a gun is never an effective tool to deal with conflict resolution. In fact, it compounds conflict. It makes conflict worse. But let's see. And also when it comes to some of these racial, ethnic, and minorities, there are also cultural differences. As we've been saying, there are certain cultural practices that are also not too helpful. And also that can also contribute to some health challenges. But most of the time, it's the racism, it's the lack of resources, and at times it's lack of trust that some of these racial groups now have for the justice system as well as the medical system, that contributes to the poor health qualities of minorities. Now, after studying this chapter, you should be able to, one, explain the concept of diversity as it describes the American people, explain the impact of a more diverse population in the United States, as it relates to community and public health efforts, explain the importance of the 1985 landmark report, the Secretary's Task Force report on Black minority health, list the racial and ethnic categories currently used by the American government in statistical activities and program administration report. Now, list some limitations related to collection of racial and ethnic health data. Discuss selected socio-demographic characteristics of minority group in the United States. List and describe the 6 priority areas of the Race and Ethnic Health Initiative. Explain the role of socioeconomic status play in health disparities among racial and ethnic minority groups. Define cultural and linguistic competence and the importance of each related to minority, community, and public health. Regardless of all the challenges that people face in this country, dealing with different groups, different ethnic groups, dealing with different racial groups. The diversity of America lies in its diverse population. The strength of this country of America lies in diversity of people. So regardless of some of the challenges that we face with the racial and some of those disparities, because with diversity brings new experiences, different experiences, and also different talents. You see, America is blessed because most of the best talents are in this country. And most of them are of different racial groups, racial backgrounds, racial ethnic groups. But most of the time, it's how best do we really take advantage of the diversity of our country. Okay, the US population, the majority is white. Non-Hispanic. Is 62%. But again, as the population ages and there's a lot of migration movement, in some states right now, the population of the majority is Hispanics. Places like Texas. And in some places, it wouldn't be long, that the country will flip from being majority white to being non-white as the majority. And for sure, those kind of things have their challenges, uneasiness. And how can some of these discussions be held without people getting afraid as to, am I going to lose my status? Am I going to lose my privilege? Which everything being normal is no. This country, everything being normal in terms of control, in terms of power, whites will still be in power for years, for ages. Then you have racial or ethnic minority at 37.8%. You have racial and ethnic classifications. Classifications used to operationalize race and ethnicity. Now you talk of race, categorization of part of our population based on physical appearance due to particular historic, social, and political forces. ethnicity. These are subcultural groups within multicultural society. Health data sources and their limitations. The challenges to collection of race and ethnicity data. Most of the time, who is really Black, who is really white, who is Hispanic, who is, say, because right now there has been a lot of interracial relationships that have given rise to interracial babies. So who is really purely Black? Who is really purely white? It's a challenge. Unreliability of self-reported data. Classifications are social construct. See, most of these classifications are social constructs. Society defines. So at one time, if there is a drop of a black blood in somebody's blood in somebody's being, that person is classified as Black. I see, and so through the years, a lot of racial interracial marriage or interracial relationship have existed. Some even during slavery, wherein some slave women were impregnated by their white masters. So you have a lot, when you talk of Blacks, you have a lot of shade among Blacks. And so classification are social construct that change over time and vary across societies and cultures. You have the bias analysis. Now, HHS works to increase reliability of data and amount of data collected. Say Health and Human Services, HHS, works to increase reliability of data and amount of data collected. So because most of the time, if the data is not reliable, the conclusion is wrong. You cannot trust the conclusion. And at times, the amount of data is not representative. It's not big enough to draw any form of conclusion. The conclusion is not right. So that's why there are a lot of challenges going on in trying to really, what sort of instrument can HHS use to collect data from each of the subgroups or each of the respective groups of this country so that they can form reliable data from which they can make predictions They can distribute resources based on the data. They can make projections. See, as long as the data is not that reliable, you're working with the wrong data, and most of the time, there's always a challenge in trying to determine how much resources go to one group and how much resources go to the other group, depending on their size and their needs. American of Hispanic origin. Hispanic origin is an ethnicity, not a race. See, at times when people say Hispanics, no, Hispanic origin is not a race, it's an ethnicity. Because that's why even within that Hispanic origin, you see some of different shades. See whites, see blacks, see in between. So it's an ethnicity, it's not a race. And right now, it is the largest minority group in the US, the Hispanic. It's the largest minority group in the US. People of Mexican origin, largest Hispanic groups. Most of the time, okay, their education. Most of the time, in terms of their education, they are not as educated as a group as compared to white. Income-wise, same. And they also have their health and belief system, which can also impact their health conditions or health practices. People having origin in any of the Black racial group from Africa, people having African Americans, people having origins in any of the Black racial groups from Africa. They form the second largest minority group in the States. More than half live in southern states. Because again, when slavery, when the blacks were brought from West Africa to the States, most of them were brought to the South as South farmers, work in farms and all other stuff. So you have a higher population of blacks in the southern parts of this country. Education is less than whites. Income less than white. Impact of slavery, very, very distinct. Because the slavery created a certain form of trauma. that has really and continues to impact African Americans in this country. And they also have their own beliefs. Not only the impact of slavery, not only what African Americans think of themselves, but what white think of blacks as inferior, as lazy, as stupid. But the reality is far from the fact, because when African Americans are offered same opportunities, in most cases, they can even outperform whites. So the big difference is resources, it's opportunities. You have Asian Americans, people of Asian descent who trace their roots to more than 20 different Asian countries. Native Hawaiian and other Pacific islanders, people of Hawaii, Guam, Samoa, or other Pacific islands, and their descendants. Most times they're immigration. Again, the number of immigrants from those areas are also increasing. Most of the time, level of education, I think they as a group, they are about the highest level of education, close to those of whites. And in some situations, especially in these terms, they might even be doing better. Income better than the other groups. And they also have their own health beliefs. American Indians and Alaska Natives, they were the original inhabitants of America, the land we call America. Many different American Indians, tribal groups, and Alaskan villages, each with distinct customs, languages, and beliefs. Relatively poor health status. And most of the time, again, they were the original inhabitants. With the Western culture, with some other cultures, transfer of their various either in terms of what they eat, start drinking, and so some of those things that were really not so much part of their culture now is part of, so their health is poor. And in some cases, certain diseases have been introduced into that population. So you have the Indian Health Service to help deal with their health issues. The US government, Native American, and provision for health care. Many tribes are sovereign nations. Tribes transferred land in US to federal government in return for provision of certain services. Most, when you hear federal lands, most of the lands that the federal government owned were once owned by Indians. So there was an exchange. You do this for me, we give you this land, we expect you to give us certain assistance. Then you have the Indian Health Services, IHS, responsible for federal health services to Native Americans and Alaska Natives. The goal is to raise health status to highest possible level so that their health conditions can be better with doctors, even though they have their own native medicine men and whatnot. But most of some of these conditions are also like diabetes, the obesity, diseases provoked by alcohol, excessive use of alcohol. So these are all things that, and also violence is also becoming part of an issue within those tribal groups. Immigrants and refugee health. Now the refugees, again, most of the time, it's a challenge. Access to healthcare, access to good housing, access to good food. Most of the time, some of these refugees are in camps, crowded places, increased possibility for disease transmission. So, because they live in camps, they live in crowded communities, they live in crowded environment. And most of the time, the sanitation is not that good. You have immigrants. Most of the time, immigrants are depending on what sort of immigrants. Some immigrants are well off. Most of the time, they are well educated. Some of them have means to take care of themselves. And depending on what sort of immigration status or what sort of visa status they have, will determine what sort of jobs they can do. Then you have the aliens. Again, these are people who are here, allowed to be here, like say students, here for a particular time, and in some cases, some might continue their education and later on decide otherwise or go back to their countries. Then you have unauthorized immigrants. So like right now, those people in the border trying to come from this North America and some of these South American places, Guatemala, all these other people trying to come to the States. And some, they live in hiding when they're able to come to the country. So most of the time, if they live in hiding, it's very difficult for them to seek services when they need it. So that's also a challenge. Can be classified into existing racial and ethnic groups as a single group, present presents special concern. Then you have the minority health and health disparities. The minority health mainly focuses on some of those diseases or health conditions, psychological conditions. Some of them have been based on prolonged abuses of race, of racism, of neglect, things like hypertension, diabetes, cancers, and you can go down the list. And when you talk of health disparities, you look between the sort of health qualities that whites get and the sort of health services that minorities get. You look at the gap, the disparities, the differences, the resources allocated for whites and for white, an ability for blacks to access health and whites to access health. Their living communities. See, all of this, there is a health disparity. The belief factor, the trust factor among health professionals, among varying groups. Then you have the federal effort to eliminate health disparities. You have race and health initiatives. The goal. See, an initiative is more like a goal with a plan. You come up with this good plan. Now here, based on, because now they know there are a lot of disparities, health disparities among whites and blacks and other minorities. So the federal government now sets a goal to eliminate disparities among racial and ethnic minority populations in 6 areas. 6 areas. Infant mortality. There are more infant mortality. The infant mortality rate is much higher among minorities than whites. More black babies die within their first year than white. And at times, why? What are some of the causes? because some of those focuses can go to start from preconception to condition during pregnancy to condition during delivery. And most of the time, some of these disparities are not so much in terms of level of education among minorities. That has been proven to be not so much of a factor. A PhD woman, Black woman, is very likely to give birth to a child that will die within the first year than that of a white. What are these conditions? What are the conditions that contribute to some of these things? So the government is now trying to say, of some of like the, the minority health organization is trying to come up with possible solutions, trying to find out why. And when you break it down, infant mortality rate among male Blacks is much higher than infant mortality rate among female Blacks. So the next is cancer screening and management. Says screen the cancer at very early stage. You manage it the right way. Most of the time, it becomes a chronic condition. But at times, do they have the resources? Or do they have the expertise? Here, when I say the expertise, is not only knowing the medicine and everything else, but those bedside manners that gives the patient that confidence that he or she is in the hands of somebody who cares about their well-being. But the key thing is also is to get African Americans start going for cancer screening at very early age. In some cases, I will even say for some in their upper 30s. If it's in the family, it can even go low 30s. Start go get screened. Breast cancer, prostate cancer, all these other forms of cancers that is killing minorities in disproportionate numbers. Cardiovascular diseases, issue of diabetes, overweight, too much fat, less activities, diabetes, HIV, AIDS. These are conditions that are caused by behaviors, sexual behavior, See, how do we manage our sexuality? Do we engage in protected sex? Do we tell our partners about our sex history? Do minorities, blacks, tell their partners about their sexual history? Especially those blacks men who engage in man sex and also man to woman sex. How faithful are we in trying to explain the level of drug use, intravenous drug use? Those are all the ways this disease is being transmitted. Do we use needles? Do we share those needles? Do we use condoms properly in our sexual activities? You see, because a good number of some of these things, there are ways that they can be addressed if we are only willing to listen, take the advice from doctors or people who really care for minorities. Because right now, the race and health, most of these things, HIV has come down greatly within the white population, but it has come down within the black population, but it's on the rise within the black women population. So these are things that we have to make sure these kind of things don't exist. We have to take care. Men have to take care of our women so that we don't infect them with HIV. And also women have to take care of their man by not infecting them with HIV. So the only way is responsible sex. Sex is fun. Could be pleasure, there's pleasure in it. But if not done with the right person for the right reasons, it can lead to a lot of problems. So as with drugs. See, people use drugs. Those with money have enough needles that after one use, they throw that needle away. For us, we tend to, okay, let me shoot, then give it to my boy. He shoots. If I'm HIV positive, he shoots. He just being HIV positive. So again, some of these are behaviors that we have to monitor within our communities. And in terms of adult and child immunization. See, right now, there is this conflict or this kind of debate about who is going to take the corona COVID-19 vaccine. My advice is we are all aware of the disparities, the abuses that minorities have experienced when it comes to medicine. But with this vaccine, please take it. Advise your parents, your uncle, your grandparents, and children should have those immunization, because most of the time that's a requirement for them to go to school. They have to see that they've satisfied certain immunization. Even with college students, we have to see if you have taken all certain required medication, immunizations or vaccinations. See, vaccines are there to prevent you from getting a disease to the point of being hospitalized and eventually die from it. There's so much stories going around about this vaccination, what is there, what is not in it, what it will cause or what not. Now, if you have the opportunity to get the vaccination, please take it. Now, infant mortality. There's a serious disparities in the US among racial and ethnic minority. African American infant death rate more than 2 times that of white Americans. And the main reason is lack of prenatal care and low birth babies. Lack of prenatal care. When conception occurs, most of the time it starts from lack of preconception and prenatal care when the infant is in vitro. And some of it also could be caused by what does the mother do in terms of going for medical checkups. What do they eat? What do they drink? Do they smoke? Do they use alcohol? See, because smoking, alcohol, and all this can lead to low birth weight. So these are things that, as time goes on, the information is already there. You see, there comes a time where we have to really do what we can as an African Americans. Let's stop smoking. When the pregnant mothers should stop smoking and try as best as possible to eat healthy. You have some federal programs that can help. And don't drink alcohol in excess. In fact, even don't drink. And worst of all, don't smoke. Because that can lead to low birth weight. And most of the time, low birth weight can lead to death of an infant because most of their organs will not be developed strong enough to be able to deal with some of the challenges. Okay, we end here. We'll pick it up the next time.